I'm not sure if it ought to be used with the nurses. I think that's where we're still trying to figure out where to go.
I understand that, and that's a big question.
Yeah. Tim is a nurse anesthetist, and would you have any concerns working alongside somebody or being put to sleep by somebody on Suboxone?
Personally, yes. I mean, you know my history, and I've got almost 20 years now in addiction and treatment of addiction, as well as the medical side. And there's just a lot of things. If you had asked me 20 years ago, I feel like I was a safe practitioner using the amount of fentanyl I was using. I'd say, heck, I was practicing better than if I wasn't using. That was my mind at the time. So I could expound on that more with Suboxone. And kind of marrying my history of addiction and treatment with my medical knowledge, I'll use the same diabetic analogy because I see this all the time in the hospital. People who are diabetic, some people who are diabetic, they're on very minimal medications because they are exercising, they're watching their diet, they're losing weight, they're doing the things they're supposed to do and controlling. And then there are the other side, the people who don't care, they'll come and eat the whole pie. I'll just take more insulin. They kind of use the medication as a crutch to kind of do some food, maybe their dish. I don't know. So I could argue that either way. I do think use of something to get off of opiates is very beneficial. I've seen it. I didn't have it when I went through treatment. I just got through it with a little clonidine, and I did fine. You know, I'm off all that, and I feel. Being a provider, I've seen people get off of it, but I've also seen people manipulate the system to get more because they want that.
That right there is the whole purpose of the counseling. We have, and I've written that in my books. We have got to teach them that there's no more substance-induced highs. That they got to let their brain, dopamine and their brain chemistry heal, and they have to enjoy life naturally.
And so when you mentioned,
if you don't get that done, we're not going to get anything done.
You mentioned the amount of counseling necessary. One therapy session a month. Yeah, that's like it should be the other way around. They should have multiple sessions a week to get off of the medication, not use the medication to buy time to get that one session. And again, that's a whole other topic there as far as included with long-term Suboxone therapy. And then what's long-term? A month, 2 months, 3 years?
Have you done long-term Suboxone counseling? I have. So I have as to the success or the lack of success of it. The problem with a lot of discussions is that there's a lot of people that are having discussions that are based on philosophical opinions, perhaps, that haven't been down on the ground.
Sure. I buy that. You know, I understand medications and what they do, and chemicals that are released, and what people will do to get them. And so my bias is on that. I do feel if I had to fall one side or the other, I'm going to fall on the side of safety and have no medication in it.
In your brain, to use kind of a stupid word, I guess, heal. Like we hope it does when you're abstinent for a period of time. I don't guess it totally heals, but at the same rate off Suboxone as on Suboxone, or maybe reset's a better word. I don't know.
I'm from Philadelphia, Pennsylvania. I am the hugest NFL fan you're ever going to come across, probably. I'm a Philadelphia. 50 freaking years, they've never won a Super Bowl. They were in 2 of them and lost both. 2 years ago, the Philadelphia Eagles beat the New England Patriots. I was standing in front of my television set, screaming and yelling and jumping up and down and almost crying because I was so happy. No drugs, no alcohol. My dopamine systems and everything. I have to enjoy life naturally. That's how I enjoy life. My experience with people. Now, you got to be careful not to overprescribe it too. I don't for anybody to ever be on more than 8 milligrams, and then you go down from there. Whereas, Tennessee guidelines and federal guidelines talk about 12 to 16 milligrams, and I think that extra pill or the extra strip is just comfort on the front end. But my experience has been to taper somebody from 16 milligrams to 8 milligrams, there's zero discomfort. I wouldn't do that. But let you go from 16 to the next month, 1.5, and then the next month that's zero discomfort. Now, what there will be, though, is a whole lot of psychological. For instance, if they get a little sweaty, I'm tapering too quickly. Well, I get a little sweaty. And that's part of the counseling. We have to teach them that everybody gets a little leg cramp now and then. Everybody, you're not going into withdrawal. So we get them from 2 strips down to 1 strip. Maybe stay there for a while, and then we take a look where you want to go from there. I've got a lot of patients that are on 4 milligrams. I've got patients that are on 2 milligrams. I've got patients that are tapered from 2 milligrams to 0. I have what you said about a little bit of clarity. I've heard some people say that. I just feel a little clearer and stuff like that now that I'm completely off the medications. Mm-hmm. I've heard people say that.
What's your average? I hate to say average because everything needs to be individualized and how your body's reacting. But the average taper to get somebody, say, from 8 off of it.
I've had this discussion with Dr. Lloyd. Stephen Lloyd?
Yeah, I saw him last night on it.
I had a discussion with him. I went over to Journey Pure because I'm in Murfreesboro. Journey Pure is in Murfreesboro. And somehow somebody put him, and I went over there and we sat down and we talked for an hour and a half. And we were like, that Journey doesn't necessarily do Dr. Lloyd's right now, but he is very much an advocate for Suboxone. And his attitude about it, which is very similar to my attitude about it, is it's not a question of length of stay, of how quickly you taper them off of it. What Cumberland Heights does, in my opinion, with putting people on Suboxone and doing a rapid 7 to 10, giving them a couple of weeks of inpatient treatment, that stuff, and then releasing them, it is clinically shown to not be effective. Federal information and the studies, 80 or 90% of them are relapsing within a year. That's not good. You'd be better off bringing them down off of it some other way than trying to do a rapid. People that take Suboxone, 90% of them are still engaged in treatment or in recovery a year later. It's the exact flip. It's the exact opposite. Dr. Lloyd understands. The doctor at Cumberland Heights does not. That's okay. I mean, they can talk about that. I'm only going to go with what I see work. Okay, to answer your question, how long should maintenance be? How long should somebody stay on an antidepressant?
It depends.
Exactly. Appropriate for somebody to be on an antidepressant lifelong. I'm starting to wonder about this so often. It's like, you know what? My kids are grown up now. I don't have teenagers anymore. I'm making good money now. Maybe the panic attacks was a lot of it had to do with that. So, maybe I think I probably will try and taper off of it and see what happens. But then again, on the other hand, if I start to have anxiety problems, should I stay on my antidepressant lifelong? I'll tell you what the guidelines say on the federal government if you're not familiar with it. It says medication maintenance with Suboxone can be a relatively short period of time, i.e. 12 months or less, or indefinite. That's what they say, and I like that because I don't want the federal government
Yeah.
telling doctors and people how to practice. So I think that leaves it pretty open.
I've read many things about people who, I've always heard, it's been your experience, that the last 2 milligrams are the most difficult tapering off. Is that
I'll
true?
tell you how to taper off that. And I just did this with the guy. I actually, I like to build websites, and I have these little companies, and I have a resource for patients website where people can go on there and get a lot of different resources. And I actually do interviews with people that have tapered off of it with their permission and put them on the site so to encourage other people that would like to try a taper to see, stuff like that. So what is the most successful is when you get down to 2 milligrams, is you go to 2.5, you go to 1.5, 1, because you can buy the 2 milligram strips, so that way it's easy to cut it up. 1.5, 1.5 final dose for a couple weeks. And when you take somebody down like that, the last I did like that, very little discomfort at all. Maybe a little difficulty sleeping the first night or two, but even that wasn't because of withdrawal. It was just they just had trouble sleeping that.
And that's from 2 to 0.5. How many weeks are we talking about?
A couple of months.
Couple months. Okay.
Yeah. No hurry. We don't want discomfort because that's what freaks them out.
Yeah. I understand that.
Now, I've had people, I had one guy that tapered off of it and was clean for 9 months and doing really, really good and decided that he could purpose that again. But I've had other people that have tapered off of it that are